Okay, let's talk about breast cancer screening. It's one of the most important tools we have for early detection, right? But it's also surrounded by so much confusion. So today, we're going to cut through all that noise. Let's separate the myths from the facts.
So let's just start with a number that, honestly, is pretty startling. A recent study in JAMA found that only about 75% of women in the U.S. who should be getting regular mammograms actually are. Think about that. That means 1 in 4 women are missing out on this potentially life-saving screening. And you have to ask, why?
Well, what if that gap? What if the reason so many people are skipping it is because of common myths? What if the things we think we know about breast cancer screening are just wrong? That's what we're going to do here. We're going to tackle those myths head on and use some solid facts to clear up all the confusion.
All right, first up, let's get into the myths about your personal risk. You know, these are the kinds of things that make people think, oh, that's not something I need to worry about.
Okay, so this one is a big one. It's probably one of the most persistent myths out there. The idea that, if breast cancer doesn't run in your family, you're pretty much in the clear. But, well, the data tells a completely different story.
And the reality is pretty striking, actually. Dr. Aparajita Spencer, who is a breast surgical oncologist, she points out that only about 5 to 10% of breast cancers are actually hereditary. The vast majority are not. So the takeaway here is absolutely crucial. Yeah, family history is a risk factor, for sure. But not having it isn't some kind of free pass. Regular screening is for everyone.
All right, next up, the claim. Does your breast size affect your cancer risk? This one pops up a lot, and it usually comes from confusing 2 totally different things. And this is a really important distinction to make. So breast size, it has 0 effect on your cancer risk. But breast density, now that's a different story. That's all about the ratio of tissue inside. Having higher density can slightly raise your risk, and, this is key, it can also make tumors harder to see on a mammogram. It's actually such a big deal that doctors are now required to tell you if you have dense breasts.
So what about this one? The idea that younger women don't need mammograms. You hear this a lot, right? That breast cancer is really just a disease for older women. And because of that, a lot of younger women think, hey, screening isn't something I need to worry about just yet.
But look, the official recommendation couldn't be clearer. The National Comprehensive Cancer Network says annual screening mammograms should start at age 40 for women with average risk. And listen, for anyone with higher risk factors, it might need to start even earlier than that.
Okay, so we've talked about personal risk. Now let's dive into the myths about the test itself, the mammogram. These are the kinds of fears and misunderstandings that can really cause anxiety and make people put off getting screened.
You know, a lot of us are taught to do self-exams, to check for lumps. And that's important, don't get me wrong. But is a lump that you can actually feel really the earliest sign of cancer?
Well, listen to what Dr. Preeti Subadar has to say about this. She explains that the whole point of a mammogram is to pick up the very earliest signs of breast cancer. And usually that's tiny little things called calcifications, not a mass you can feel. It's all about finding it before you can feel it. I mean, that is the power of early detection right there.
Okay, this one is huge, a really big one. The fear that the radiation from a mammogram could actually cause cancer. And you know what? It's an understandable concern. So let's really break it down and put the risk into perspective.
Let's just look at the numbers, side by side. The risk of getting a radiation-induced cancer from a mammogram, it's about 1 in 5,000. Okay. Now, what's your lifetime risk of just developing breast cancer in the first place? It's 1 in 8. So 1 in 5,000 versus 1 in 8. When you see it like that, it's pretty clear, isn't it? The benefit of catching something early just massively outweighs that tiny risk from the test itself.
Let's be real. Mammograms aren't always the most comfortable experience. So it's only natural to wonder, hey, are there any other options? Something easier or safer that does the same job.
But the expert consensus on this is really firm. Right now, the mammogram is called the gold standard for a reason. It is the only screening test that has been proven to reduce deaths from breast cancer. Now, other tools like MRIs and ultrasounds, they are incredibly important, absolutely vital, but they're used for diagnosis after something suspicious is found. They're not a replacement for that first crucial screening.
Okay, so picture this. You get your mammogram, the results come back clear, and you breathe this huge sigh of relief. You're all good, right? Does that mean you are 100% in the clear?
Well, a clear mammogram is definitely great news for that day, but it's not a guarantee forever. The truth is, sometimes very early stage cancers can be missed, and new things can develop in the time between your screenings. And that's exactly why this has to be a process, not just a one-and-done thing. Consistent, yearly screening is really the only way to stay on top of it and catch any changes as early as possible.
All right, now this next myth is a really dangerous one. The idea that a breast biopsy can actually spread cancer. So if a mammogram shows something that looks a little suspicious, the next step is usually a biopsy to get a tissue sample. And the fear is that poking it could somehow make cancer cells spread.
But listen, Dr. Spencer is extremely emphatic about this. A biopsy isn't just safe, it is absolutely critical. It's the only way doctors can confirm a diagnosis. And beyond that, they learn so much biological information about a tumor from that one sample, information that is essential for figuring out the best possible treatment plan.
Okay, so we've busted a lot of myths. Let's shift gears and talk about why this all matters so much. What's the real-world impact here? What does early detection actually do?
Just look at this number. Over 3 million breast cancer survivors in the U.S. today. That's not just a statistic, right? That is a powerful, powerful testament to the incredible progress we've made. And it's a direct result of one thing: catching cancer earlier, when treatments are way more effective and a lot less invasive.
So let's just do a super quick recap of the big takeaways here. Number 1, screening should start at 40 for most women. 2, mammograms are the proven gold standard for detection. 3, don't just rely on family history. Most cancers are not hereditary. And the most important one of all, early detection really, truly saves lives.
So there you have it. We've cleared away some of the biggest myths and laid out the facts. But you know, the real power of knowing this stuff is actually using it for yourself and maybe sharing it with the people you care about. So I'll just leave you with this final question.